Let's also keep an eye out on what's happening with respect to the caseload, which is increasing in Maharashtra as well as across the country. Joining in right now to talk a little bit more about that is Dr. Shashank Joshi. He's the Dean Indian College Physicians at Lilavati Hospital. Thank you so much for taking time out and joining in. As we are seeing the COVID vaccination drive as well pick up momentum, there is continuing to remain that a sharp surge that we've seen over a fortnight. What's the situation looking like, and how worried should one be?
So clearly there are signals that we are in Maharashtra and Mumbai has entered into the second wave. We are seeing a test positivity rate of around 7 to 8% for Mumbai city and around 13 to 14% for Maharashtra. Clearly we are testing more, so the numbers are more, so that's nothing to panic. Recovery is around 90%, death rate and case fatality rate is low. Probably the virus has changed its behavior, but it appears to be less virulent. That's what is our hope and prayer. And we need to vaccinate the most vulnerable groups. So the good things are that we have a better recovery and a lower case fatality rate. The numbers are absolutely worrisome. And in Vidarbha and Maharashtra is under a partial lockdown, and Marathwada is also under a partial lockdown. And in Mumbai as well as MMR and Pune, where is seeing a very high surge, we are appealing to citizens to maintain COVID-appropriate behavior, double masking in crowded, avoiding crowds, and also to people in malls, restaurants, to ensure that only 50% occupancy and COVID protocols and norms are followed. And that's an appeal, and we have launched the campaign "Me Responsible." So let us hope and pray that in the next 2 weeks we see a downward trend. Otherwise, we will see very high numbers coming up. The biggest challenge we face are asymptomatic patients, because there's a large population, almost 85% of the patients are asymptomatic, and they are the ones who we find it very difficult to contain at home for almost 10 to 14 days, and that's the big challenge we have. And therefore, we are thinking of doing institutional quarantine for asymptomatic people who are testing positive and increasing contact tracing to 1:30.
Oh, yes, indeed. That continues to remain a worry. But, Doctor, I believe that there are some studies now conducted that the vaccines that have been given by COVID are less effective at neutralizing the variants which are circulating of the coronavirus. Should one be worried, the variants coming from Brazil, South Africa, UK, etc.?
So the Covaxin is 100% effective against mutant. There is data available on that. So Covaxin currently probably is the only vaccine in the world which has that data, which is effective against all variants. And of course, Covishield also is effective against most common variants and is also effective against homegrown variants. We suspect that the variants which are seen in Maharashtra particularly appear to be homegrown variants. There has been no linkage to any imported, mutant by the various genomic surveillance studies which have been done by Government of India.
Dr. Joshi, asked this question that for those who have taken a vaccine, and largely the elderly population, healthcare workers, people 45 above with comorbidities, how safe are they? The fact that only the first shot has been administered, whether it is Covaxin or Covishield, can they also be carriers? Because I get a sense when I look around that there is some degree of careless approach which at least has come out for people who've been vaccinated, and even though they've got the first jab.
Oh, absolutely. I think, till you don't get both your shots and till another 15 days don't go by, you are not protected. And even if you have taken the vaccine and after 2 doses and after 15 days, you still need to follow your masking protocol. So there is no need to lower your guard. And you're absolutely right that once you get a jab, it doesn't mean that you will not get COVID. You can very much get COVID. Only thing, it will be less severe, it won't kill you. But one jab is not going to be protective at all. So and most people have only got one jab. Most healthcare workers and frontline workers are now getting their second jab. So I think we still need to follow our COVID-appropriate norms, and we cannot afford any complacency in any of the vaccinated group at all. You're absolutely right.
If you have to compare the trend which we saw, and that was a scary trend, let's say between August to October or from June to October, and the trend which has started a month ago in Maharashtra and 15 days ago in Mumbai, what are the comparables and what are the differentiating factors?
So I don't think we can compare. That time we were on a learning curve. We had a more virulent disease. Our hospitals were fully occupied, and we had a higher case fatality rate. So if the current trends continue, the numbers may match those numbers. But in terms of the virulence, the case fatality rate will definitely, and the asymptomatic cases will definitely do better. But definitely it's a cause of concern. I would not say, and it would be inappropriate for me to say that there is no cause for concern. We are hugely concerned because we are seeing a clear red flag, and orange is already there. It's only not become red. That's the only thing.
Do you think a lockdown and a stringent lockdown is something which should be considered very, very seriously? Because what really, in a sense, made the difference, at least in the first wave, was that the administration was able to come up with stringent lockdowns, and now it's time to consider that?
Not at all. I don't think lockdown is any solution for any COVID pandemic. That time it was necessary the first time, and it worked the first time. But now what we'll need is micro-containment, sealing off of buildings, sealing off of floors, sealing off of zones. So current strategy is going to be increasing contact testing, aggressive testing strategy, home isolation, institutional isolation, as well as micro-containment. So I think containment and stringent measures, and people who don't follow up the protocols, for example, if shops and establishments don't follow protocols, then they should be sealed. I think, because of a few black sheep, the whole establishment need not suffer. So I think it is time that we will have to look beyond strategies of lockdown, and we'll have to look at micro-containment, delineation of zones in a better way, and ensuring that all the violators, they get sealed out, but not people who are complying with the COVID protocols and norms.
Thank you for all the good work and hard work which you and your team is doing.